Hello, my name is Muhammad Ilyas bin Abdul Rahman. I'm going to present on topic anaphylaxis. This is a topic that I chose for my clinical posting in pre-hospital care in emergency department of Hospital Sultanah Nora Ismail, Batu Pahat. For introduction, pre-hospital care or PHC is characterized as being patient care from injury or disease to the position of definitive treatment. PHC includes correct patient using the correct mode of transport to the right place of medicine in the proper time frame. This is a very crucial part of PHC that you need to have a correct patient using the correct mode of transportation to the right place. Then it includes transferring skills and techniques from pre-hospital care mainly by assistant medical officers that allows early advancement in management of patients in a variety of disciplines. We know that AMOs plays a vital part in pre-hospital care in Malaysia. Next, AMOs should be taught with extensive understanding of health, surgery and trauma pathology, who will often work from standard operating procedures but can revert core principles. Based on leading causes of admission public hospitals in Malaysia in 2016, ischemic heart disease covers the majority of the cases, which is 13.2%, followed by pneumonia 12.5%, CVA 6.9%, and road accidents 5.4%. The roles of pre-hospital care is a core business in the profession of assistant medical officers, as mentioned as mentioned earlier, as they are manned by majority of basic services in Ministry of Health Malaysia, both for hospitals and clinics. Therefore, before arriving in a hospital, great care must be taken when treating an acutely injured patient. Anaphylaxis is a severe rapid onset of allergic reaction that can lead to death. It usually causes more than one of these factors, which is itchy rash, neck or tongue swelling, shortness of breath, vomiting, lightness, low blood pressure. The mechanism involves the release by immunological or non-immunological mechanisms of mediators from several types of blood cells. The diagnosis based on signs and symptoms following exposure allergy. Generally, there are many clinical signs of anaphylaxis over minutes or hours. Usually, they are from 5 to 30 minutes when intravenous, but 2 hours when food is eaten. Anaphylaxis is among the most affected areas are skin, being the majority 80 to 90%, respiratory 70%, gastrointestinal 30 to 45%, cardiovascular 10 to 45%, central nervous system 10% to 15%, and CNS usually involving two or more of them. These are the signs of anaphylaxis. You can see in the skin there are urticaria, itching, and flushed skin, swelling of lips and tongues and throat and face. During a pre-hospital care, it is important for AMOs to detect all of these signs of anaphylaxis. Next, you can see in the airway, around 80 to 90% of reactions, patient may complain of tightness, swelling of the throat, hoarseness of voice, scratchy throat, troubling in breathing, wheezing, chest tightness. For central nervous system, patient may feel anxiety, headache, dizziness, confusion, tunnel vision, and fainting. For cardiovascular system, patient in 30 to 45% of cases, patient may feel chest pain, low blood pressure, and rapid heart rate with pulse. You can palpate the radial pulse, and you can see the pulse pressure is low. For GI tract, for 30 to 45% of reactions, patient may feel nauseated, abdominal cramping, vomiting, and diarrhea. These are potentially life-threatening symptoms, so it is crucial for AMOs to detect all of these signs when attempting patients with anaphylaxis. So the cases that I attended during my clinical posting is a 65-year-old woman, Mrs. E, called her family doctor to complain of pain in her shoulder. IM diclofenac sodium or boron 20 mg was given by visiting doctors at 5:20 p.m. 30 minutes after administration, her throat began to swell. She developed a rash and she felt dizzy and exhausted. These are the symptoms that we have discussed earlier. Mrs. E called 999 for the ambulance service at 6 p.m. When the pre-hospital care team arrived, which is me and my team, at the scene at around 6:25 p.m., the patient was lying in an armchair and only partially conscious. It was noted that the patient had an allergic reaction to IM diclofenac sodium that was given by the visiting doctor earlier. This is the boron. So patient Mrs. E is a 64 years old Chinese female with underlying of diabetes mellitus and hypertension with follow-up with clinic Satam for every 3 months. Previously, Mrs. E had never been any allergic to medication or food. So Mrs. E never knew that she was allergic to boron before. Mrs. E lived with her husband, a 60-year-old man, retired man with no known medical illness. So for my assessment and management, ABCDE is and its variants are initialism of mnemonics for crucial stages used by medical experts and lay people, such as first responders, when dealing with patients. ABCDE refers to airway, breathing, circulation, and exposure. ABCDE assessment and the treatment varies acute medical and trauma scenarios, ranging from first aid to hospital, ranging from first aid to hospital medical treatment. ABCDE are necessary for survival, as they are must done with the order of the next food correctly. We'll start with airway assessment. On arrival, it is noted that Mrs. E appeared tachypnic, her about 26 per minute, speaking in phrases. There are signs of airway compromise, include cyanosis, and the use of accessory muscles is presented. The evidence of angioedema also presented upon assessment. The proof of airway swelling, laryngeal edema, is presented and causes patients to have difficulty in speaking, which is a hoarse of voice, breathing, and swallowing. The presence of wheezing sound indicates that bronchospasm occurred. The mouth is open for inspection, but there's no foreign body or secretion that blocks the airway. For the intervention, to assist Mrs. E's breathing, nasopharyngeal airway (NPA) is inserted. NPA is a soft plastic tube that is available and they describe as and there is bevel tip and flange. The semi-conscious patients tend to tolerate with NPS better than whose are oropharyngeal airway. However, in patients that have sustained base skull fracture, NPA use is not recommended because of the tiny but potentially deadly risk of entering cranial vault. But in this case, this is not a trauma cases. This is a medical case, so it is safe to use NPA. So for next, we are going to B, which is breathing. During this breathing assessment, it is noted that Mrs. E had a respiratory rate of 36 per minute. The increased breathing rate is a common feature of anaphylaxis and indicates significant respiratory compromise. The oxygen saturation SpO2 of Mr. E is measured at 93% under room air, which is in hypoxemia. Hypoxemia is a sign of anaphylaxis. On auscultation, there was a generalized bronchi and associated with reduced entry bilaterally. These findings are concerned in indicating a significant airway compromise and the need for rapid breathing intervention. So for breathing intervention, I put Mr. C in an upright position. This is because an airway compromise, the lungs become hyperinflated. The extra air is trapped in the lungs. The diaphragm becomes flattened and cannot work efficiently. Then a forward lean position can help to encourage the diaphragm into a more dominant place to work more efficiently. A nebulized bronchodilator is a combination of epratorium bromide with, with, with 1 ml of salbutamol and 1 ml of normosaline. Epratorium bromide is atrovan. We use a ratio of 2:1:1. 2 atrovan, 1 salbutamol, and 1 normosaline. The nebulizer is used to loosen the mucus in the lungs. This mucus could also be exhaled. Next, we go into the circulation assessment. Mr. C had a pulse rate of 120, which is a tachycardia. Tachycardia is a common finding in anaphylaxis. BP was 100/60 with MAP of 60. The peripheral was cool with prolonged capillary refill. So for intervention, a large bore of 14G IV access is inserted for efficient fluid and medication given. I am adrenaline 0.5 mg over anterolateral aspect of the middle third of the thigh. Why we are giving to the thigh instead of other muscle? Because in the anterolateral aspect of the middle thigh, they have a large bulk of muscle, so it absorbs the adrenaline better. This the I the Piriton chlorpheniramine 10 mg is given along with the fluid resuscitation. Chlorpheniramine is a muscle stabilizer and lowers systemic distribute. Next is IV hydrocortisone 200 mg was given to prevent rebound inflammation over the next few hours. Next we go to the disability assessment. Consciousness was assessed with the AVPU scale. These are 4 levels of AVPU. The first is alert. The patient is alert but not necessarily oriented. Next is verbal. The patient responds somewhat when communicating to them, such as words or grunts. Pain. The pain answers the painful stimulation, such as supraoptimal pressure around here. And the fourth is unresponsive. The patient shows no eye, tone, or motor reactions to pain. Next, we go into the disability assessment. It is noted that Mrs. E. AVPU responds to verbal. After the AVPU method is determined, the more detailed level of consciousness assessment which is Glasgow Coma Scale (GCS). This GCS evaluates the person based on their ability to move, talk, and move the eye. The three compartments of the three compartments comprise of three elements of the scale of the eye, the verb, and the motor. The GCS score of a person may range from 3, totally absent, which is totally unresponsive, to 15, responsive. The GCS for Mrs. E was E3, P4, M5, which caused Mr. E GCS of 12/15. This is the GCS that we discussed earlier. For next, for the disability interventions in the area, AMO must maintain the patency of the airway because airway is the very vital part of the patient. If the patient is not breathing, the patient is going to die. It is also crucial for AMO to regularly reassess the level of consciousness to prevent the airway compromise. Always reassess the patient. The first of your assessment might patient may be deteriorating after that. Next, blood investigation in PHC is limited to none, but we have a capillary blood glucose. It is noted that GM for the patient is 4.0 to 11. I'm sorry, the GM for the patient is 6.7. So it is normal because normal range for GM is 4 to 11. Finally, the exposure assessment. And the exposure assessment is a process by agent's exposure is estimated or measured together with the amount of attributes in the exposed population. Mrs. E is present with evidence of anaphylaxis such as urticarial rash and angioedema. We can see that in the skin of the patients. So for interventions, first we already know the allergen, which is the diclofenac sodium given by the visiting doctors over intramuscular. Then it is crucial for us to recommend to the patient that the patient should not take the envelope again or any NSAIDs maybe. Finally, the final part of the management, we always need to reassess A, B, C, D, E, then we triage the patient. So reassessment of the Mrs. E using ABCD approach was done to identify any changes in their clinical condition and assess the effectiveness of the previous interventions. If any deterioration should be recognized quickly and acted upon immediately. So trust systems are strategies for prioritizing patient's treatment as a matter of urgency. The trust consequence should be affect the other prioritization of emergency treatment. With signs of impending respiratory failure, Mrs. E was rushed to red zone. The final step, we must review the history of anaphylaxis that triggers and look at the medical record. In addition to the patient, the MO may have a collateral history from relatives as needed. Next, the patient's note, statistic and latest investigation results should be examined by MO. Next, view the recent medications of the patient and check for regular medications appropriately. Document precisely the ABCD evaluation, including history, findings, investigation, and interventions, and the patient's response. Finally, all medical history medications and improvement of the condition Mrs. E will be passed on to the attending emergency department's doctor. These are all my references. Thank you.